The data center backlash has lawmakers rolling back plans to expand high-power transmission lines. What it means for rural residents on today's Texas Standard.
Texas Standard is a production of KUT Austin, KERA North Texas, Houston Public Media, and Texas Public Radio in San Antonio.
I'm Angela Kocherga in El Paso. Also ahead, how seniors are coping with the high cost of food. Plus, if you have a pet, you know veterinary care can be costly. And that has some families skipping a trip to the vet. A Texas organization steps in to help. Also, mapping extreme heat, why certain parts of Houston result in more people ending up in the hospital. And as students begin a new school year and cheer on their teams, which high school has the strangest mascot? Those stories and much more ahead on today's Texas Standard. No matter where you are, it's Texas Standard Time on this 25th day of August, 2026. I'm Angela Kocherga in El Paso, and so glad you can join us. Memories of Winter Storm Uri are painful and cause for fear for Texans who lived through the deadly freeze. Combine that with the new fears about the rapid build-out of data centers, and you have a perfect political storm. The issue? High-power transmission lines approved by lawmakers to serve growing demand for power, especially in areas where data centers are popping up, like in rural West Texas. The problem? Property owners don't want the high-capacity lines on their land. But scrapping the plan to build more than 760 new lines will affect more than data centers. The state's grid operator says residents could face higher energy prices and be at risk for rolling blackouts in parts of West Texas. It could also curtail expansion of the oil and gas industry in that region. Here to help us understand all of this is Paul Cobbler. He's the economy and industry reporter for the Texas Tribune. Paul, welcome back to the Standard.
Hey, thanks for having me again.
Well, after a House committee meeting last week, a bipartisan group of 30 representatives called on the Public Utility Commission to deny the transmission line applications for this project. What do they want to see done instead?
At this point, they really just want to go back to the drawing board. These legislators, after hearing hours and hours of testimony from residents living near the path of these transmission lines that are unhappy with the approval process, which was shortened by this very same legislature on a very near unanimous basis in 2023. They feel like it's too short. They don't have the opportunity to be able to stand up for their property rights and weigh in on the process. And so that's been the request of these landowners and now their representatives in the legislature, basically saying that we need to redo this process to give residents, landowners that would have their land impacted by these transmission lines more time to weigh in. And the only way to do that is to deny these applications to build the transmission lines and then allow the legislature to go back in 2023 and change the law.
Well, in the piece, you're right that for the first time since Winter Storm Uri, the state's electrical grid is a, quote, political albatross. Why?
It's really just data centers and transmission lines. I mean, and I think that's a way of oversimplifying it. I'm sure your listeners have been hearing a lot about both of these issues recently, but it really comes down to rural Texans are the ones that are being impacted most by both of these projects. And we've done at the Texas Tribune a lot of analysis of planned data centers in the state of Texas, and a majority of the more than 200 that are planned to be built in the state over the coming years are planned for unincorporated parts of counties, so rural Texas, where there is no city government, no city zoning laws that can govern where these data centers can go. So residents living near them have felt kind of powerless to stop sort of this wave of construction that's happening in primarily rural conservative Texas. And then these transmission lines are being built pretty much from the eastern half of the state. There's 3 different paths, but they run all the way through West Texas to the Permian Basin. And that also is basically carving, a big long swath right through very rural, very conservative Texas.
Well, let's talk about what's the concern about the transmission lines on land. Are they taking land to build them, or explain what residents are unhappy about.
Yeah, so the transmission lines, they require about 200 feet of right-of-way. They are large. I mean, these lines are 765 kilovolt lines. These are a type of transmission line that exists in the United States, but none of them have been built in the state of Texas before. We've done these lines that are called 345 kilovolt lines. They're also quite large if you think of sort of the larger transmission lines you might see driving down I-35. But these are even bigger, so they require even more land. They're just even more of an eyesore because they're a little bit taller. And sort of the argument is, why do we need these big, large lines that are going to carve through my ranch, in West Texas, or my property in the hill country? That's not something that people love in general. And, when it comes with this shortened process that makes people feel even more so like the eminent domain process that is happening here is already against them from the start. I think that is a lot of sort of the reason why we are having so much frustration build over these lines from a lot of these residents.
Well, ERCOT says that West Texas is at risk for rolling blackouts if more power lines don't get built. I'm in El Paso, and we're on a different grid. So to kind of define the region of West Texas that's affected, and how are lawmakers balancing that risk with the landowner concerns?
Yeah, so I guess the easiest way to quickly explain the ERCOT grid kind of path is that it goes to almost El Paso, but we are talking the Permian Basin, most of West Texas here, that is dealing with grid congestion. And I think the easiest way to think about a transmission line is the same as a water pipe or a highway full of cars, is that there is a maximum capacity for the amount of electrons that can flow through a line. And as the oil and gas industry has energized in recent years, a lot of their operations have previously been just going off of diesel generators. That is increasing the electricity demand in that region by quite a bit. And then also, these are two separate things, but I think it is totally fair that they are being conflated in sort of the eyes of the public, is that the data centers that are also being built in, West Texas, in a lot of these rural areas, are also increasing the state's electricity demand. And so if we have more demand in the West Texas and the Permian Basin region, we need to be able to get power to these people somehow. So the ERCOT and the PUC have basically identified transmission lines and just sort of piping in this electricity from the eastern half of the state where there's more generation to this West Texas Permian Basin region is sort of the solution to this problem.
Well, you talked about that frustration over the House bill which passed in 2023 in response to Winter Storm Uri. What did that law do, and why the dispute, and really how can this all be resolved?
Yeah, so House Bill 5066 was passed in 2023, and like I said, it was near unanimous by both chambers of the legislature, signed into law by the governor. This was done originally basically to direct the PUC and ERCOT to come back with a plan to deal with these kind of longstanding issues of electricity congestion in the Permian Basin region, and that led in 2024 to the Permian Basin Reliability Plan, which is really what initiated this whole transmission line thing. But also this bill sort of acknowledging the need for a rapid build out of some sort of transmission infrastructure network, shortened this approval process for the applications that transmission utilities filed to the PUC. It shortened it from 360 days to 180 days. And that was essentially done just because the transmission utilities were saying, we need to build these quickly and we need this process to be faster. And so the legislature thought that would be okay. But, as we've heard in all of these hearings, they have certainly learned from a lot of their constituents that the timeline is too short and it needs to be changed.
So people want to weigh in a little bit more. Paul Cobbler is the economy and industry reporter for the Texas Tribune. Paul, thank you so much for your insight and for this reporting.
Thank you so much for having me. I appreciate it.
A trip to the grocery store is a lot more expensive. Ground beef, tomatoes, and coffee have all seen big spikes in recent years. Those higher prices can be especially hard on older adults on fixed incomes. The Midwest Newsroom and Harvest Public Media contributor Nicole Grundmeyer spoke with seniors about the tough choices they often have to make.
Once a month, the people who live at this low-income retirement community in Storm Lake, Iowa, gather to create their own food pantry. The donations come from the Food Bank of Iowa.
How many of the peppers?
Today, fresh pineapples, potatoes, and bell peppers pile up on tables. The residents can go through and take the items they need. Linda Rufus, who is 67, relies on this pop-up pantry.
Well, I'm thinking about how I'm going to rob Peter to pay Paul because food prices are extremely high, and I have to really weigh out what's more important or how I can get the most out of a meal.
Rufus says she's stretching every dollar and trying to find cheaper, filling food items. While she loves beef, she's now buying ground turkey. Her neighbor Tony Keller is also shopping at the pop-up pantry today. The 65-year-old spent years outside the workforce as a caregiver, which reduced her retirement benefits.
I get a whopping $304 a month because I had a sick child, so most of my time was spent with her.
That Social Security payment isn't nearly enough to cover Keller's living expenses, including food. She relies on SNAP federal food assistance and programs like this pop-up pantry. She recently completed treatment for breast cancer and tries to prioritize eating fresh fruits and vegetables.
After having cancer, you're eating a little differently, which costs more money to do.
High food prices are pushing older adults to make difficult budget decisions affecting their health. Nationwide, food prices were 3% higher this June compared to the same time last year, according to federal data. Jessica Johnson is a senior strategist at the National Council on Aging.
So much of the conversation around SNAP and food insecurity really has been around children and families, and older adults really are often a forgotten population.
More than 7 million Americans aged 16 up experienced food insecurity in 2023, according to the National Council on Aging. That's approximately 1 in 11 older Americans. Gina Plata-Nino is the Director of Policy and Advocacy at the Food Research and Action Center. She says Social Security benefits don't protect older adults from hunger.
Your rent didn't decrease because you turned 60. Your utilities didn't decrease because you turned 60. Neither did fuel and neither did food.
Nearly half of older adults who carry credit card debt are using their cards to buy food, according to the AARP. In the Kansas City region, Metro Lutheran Ministry operates 3 food pantries. Community Assistance Manager Kimberly Bernard says they're seeing consistently high demand from older residents.
We see a lot of people that are in that population of seniors that they really rely heavily on the food pantries because it's a challenge for them to be able to budget the amount that they receive monthly.
Back in Iowa, Linda Rufus says she and her fellow residents at the Storm Lake Senior Housing are grateful for the pop-up pantry.
Because if it were not for the food banks, supplying us with food, we would be in a lot worse condition than we are.
But for now, experts say seniors on fixed incomes will likely continue to feel the squeeze of high food costs. For the Midwest Newsroom and Harvest Public Media, I'm Nicole Grunmeyer.
Harvest Public Media is a collaboration of public media newsrooms in the Midwest and Great Plains, including the Texas Standard. Another indicator of hard economic times for some families, pet owners are skipping a trip to the vet. We'll tell you how a Texas organization is trying to help when the Standard continues.
Support for Texas Standard comes from UT San Antonio, providing education and research for communities across Texas, with a focus on student success and workforce development. The University of Ambition, ambition.utsa.edu.
You've got it tuned to the Texas Standard. I'm Laura Rice. While economic indicators in the U.S. are mixed, on a base level, it's fair to say a lot of Americans are feeling the pinch. Costs at the grocery store are high, and so are gas prices, and for a lot of us, wages haven't kept up. It's leading a lot of folks to make some hard decisions about spending, including on their pets. A poll earlier this year from Gallup and PetSmart Charities found more than half of pet owners skipped needed veterinary care. Most of those people said they did so because it was too expensive. A Texas-based vet group is trying to fill the gap. The Spay Neuter Network was founded in Kaufman County, southeast of Dallas in 2004, and has expanded to operate clinics across the DFW area in San Antonio and through a mobile clinic. Kathy Rosenthal is the network's Director of Public Outreach. Kathy, welcome to the Texas Standard.
Well, thank you for having me.
Well, it seems like everything's become more expensive. So is it just our imagination or are vet bills actually up too?
No, they're very much up. They estimate that vet care has increased by about 60% since 2014. And that's really not a surprise, right? Because everything is costing
Mm-hmm.
more. But for people in underserved communities, which is a lot of time, that's the focus of our work, anybody can come to our clinic for services, but our focus, our outreach is in underserved areas. So in those areas, they face different barriers to care, right? It might be financial, that's the number one. People can't afford things. Two, maybe they don't have transportation, which we try to address with our mobile clinic and our transport program that operates kind of like a bus stop. We go into communities, pick up animals, and bring them to our clinic for service. And then obviously the need for more vets. We personally have experienced some challenges in that area. Vets cost more to do spay neuter, and there's not as many vets who are doing high volume spay neuter these days. So we're trying to address the affordability thing from a number of different angles.
Well, let's break that down a little bit. I mean, you mentioned that especially those at the lower end of the income bracket are who you're focused on. But I was struck at the poll that people of all income levels feel that either they couldn't afford the cost of vet care or that it's not worth the price. Why do you think even higher earners are feeling that way?
Well, because it's gone up exponentially. So, for example, my son lives in Dallas and he had a dog that he adopted and he wanted to get the dog spayed. It was going to cost him $1,000. Now,
Mm.
he makes a fairly good salary, but he also has, a family of four, two car payments, house payment, and it was just really difficult for him. And so he ended up going to the spay neuter clinic. I think it was like $125 and then vaccinations.
Mm.
So everybody feels it. I mean, I don't know. A big thing is humane euthanasia as well, right? Like, so when my dog's time, it was time for my dog to go. I took my dog to my vet's office. It was $400 to
Yeah.
euthanize him. So that's even a challenge for pet owners. What do we do at the animal's end of life? Veterinarians, though, are good at recognizing this, though. They know that pet owners on all ends of the spectrum are having challenges. And for the most part, if you talk to your veterinarian, they should work with you a little bit on trying to determine what's the best level of care that you can provide with the resources that you have.
So, Kathy, what are the risks of skipping, say, an annual visit, especially if your pet seems fine?
Well, annual visits are very important, right? Vaccinations, rabies, that's required by law. Just making sure your pet is healthy. But what ends up happening when people start to skip these appointments is that a small problem starts to escalate.
Mm.
And people love their pets. They want to take care of them. So when a pet has a health problem that they can't afford or starts to get to a point where they can't take care of the pet anymore, they're more likely to turn that animal into an animal shelter. And we want to keep animals out of the shelter system. So my recommendation is that ask for help early. If you see a health problem arising, call around. Don't wait till the problem gets worse or it's in a crisis situation, because then you're having to make quick decisions and you can't take the time you need to look around for more affordable care.
So you mentioned, costs are up because costs of everything are up, and so some of that's
Yeah.
being passed along in this vet care. But there's also, as you mentioned, an issue of the veterinary workforce shortage. So how is the spay neuter network helping with that?
So the problem what we have is that 30 years ago, when high volume spay neuter came around, and what high volume spay neuter is that a surgeon comes in and does like 30 to 50 surgeries, spay neuter surgeries a day.
Hmm.
That's high volume. There's specialized techniques and vet techs. There's several vet techs. We have a couple operating tables, and while the doctor is doing surgery, spay neuter on one animal, a vet tech's getting a dog or cat ready on another table. So it's almost assembly line, but I hate to refer it to it that way because it doesn't
Right.
sound good. But the idea is try to get as many animals spayed and neutered as possible. Those vets that started the program 30 years ago are now retiring. And we're combining that with the fact that veterinarians are coming out of vet school with only 1 to 2 surgeries under their belt. So the only way they can learn surgery is through private practice, a vet who's already a surgeon teaching them surgery. And we realized that if we didn't jump on this this problem right away, that down the line we were going to have more issues than we have today. So right now, our clinics are open 4 to 6 days a week. But we have had weeks where the clinic is only open 2 days, even though we have a full week's worth of appointments because we can't find vets who are skilled in high volume spay neuter. So we launched the veterinary mentorship program. And so far, since January 2024, we've trained 225 vets, and they have contributed more than 7,000 surgeries just our clinic alone. So in training these vets, they're not just helping nonprofit clinics, they're going to go back to private practice clinics and be able to do more spay neuter surgeries as well.
So for folks listening who are in your service areas, they can look you up for pet needs. But how about others who are looking to keep their pets healthy but reduce costs?
Well, there's lots of resources in most communities. All you have to do is call spay neuter clinics, you can call animal care services, and you can call animal shelters, private, like nonprofit animal shelters. They should be able to tell you what low-cost services are available. Almost every community will have low-cost vaccinations. Most communities will have some sort of low-cost spay-neuter resource. Not all. The challenge is in rural communities, right? So in North Texas, we have clinics in Dallas, Crandall, and Fort Worth, but we serve 16 cities and 34 counties. So our transport vehicle will go out into more rural areas. People, might have to drive an hour to get to our clinic, but we'll go get the animal and bring them to our clinic. So I think the thing that most people need to realize is that there is help out there. They just need to call around and try to find it.
Kathy Rosenthal is the Spay Neuter Network's Director of Public Outreach. Kathy, thanks so much.
Thank you.
Hey there, this is Texas Standard's Assistant Digital Editor Raul Alonso popping in to let you know something cool. You can now listen to Texas Standard on YouTube. We post full episodes each weekday afternoon, and you can also find extended video interviews with celebrities and newsmakers. Just search for Texas Standard on YouTube.
Support for Texas Standard comes from HEB and the My HEB app, which is available for download, and shopping fresh departments like seafood, produce, bakery, and deli, and scheduling curbside pickup or home delivery. More at heb.com. Support for Texas Standard comes from Texas Casa. For a child in foster care, small moments today can have a big impact tomorrow. More on how lending time and support can help make a difference at becomeacasa.org.
Live from the Texas Newsroom, I'm Shelby Rose. A hearing is scheduled today in Brownsville on the extradition request from Minnesota for an ICE agent held in a Texas jail. Governor Abbott has resisted sending Christian Castro back to Minnesota, saying he doubts he meets the definition of a fugitive. Castro is charged with assault for allegedly firing through a door during an immigration crackdown earlier this year. President Donald Trump will headline a Republican National Committee fundraiser in Houston this Thursday to boost Attorney General Ken Paxton's bid for the U.S. Senate. Houston Public Media's Andrew Schneider reports Trump is pledging to spend hundreds of millions of dollars to keep the Senate in Republican hands this November.
Federal Election Commission records say the pro-Trump super PAC MAGA Incorporated raised more than $400 million as of the end of July. John Link, Senior Vice President of Data at AdImpact, says that spending driven by President Trump plus Democratic spending will push the overall cost of the Texas Senate race alone to more than $440 million by Election Day.
That would make it the second most expensive Senate race in history.
Democratic State Representative James Tallarico has heavily outspent Paxton since their respective primaries. Link says Paxton is likely to boost spending dramatically after September 4th. Federal election laws require lower advertising costs within 60 days of a general election. I'm Andrew Schneider in Houston.
The Federal Reserve Bank of Dallas forecasts a slight increase in job growth in Texas by the end of this year. Texas Public Radio's Brian Kirkpatrick reports.
The Fed reports job growth for the year will increase by 1.7% for a total of 241,000 new jobs in Texas. Job losses statewide in July were concentrated in construction, financial services, manufacturing, government, information services, trade, and transportation. Some sectors saw increased hiring last month, including professional and business services, education, health services, and leisure and hospitality. The statewide unemployment rate was up to 4.5% in July, but it was down in San Antonio, New Braunfels, and Houston. The unemployment rate was reported unchanged in Austin, Dallas, and El Paso. I'm Brian Kirkpatrick in San Antonio.
Wildfires are burning across parts of Texas, including the Ross Fire west of Fort Worth. It's burned 50,000 acres and is just 5% contained. Evacuations are underway in Jack County, while residents in Palo Pinto County are also being urged to leave. Strong winds, high temperatures, and dry conditions are fueling fires across the state. I'm Shelby Rose in the Texas Newsroom.
You're listening to statewide news from public radio stations across Texas. This coverage is only possible because of support from listeners like you. You can help sustain and grow Texas news coverage by donating to your local public radio station today.
33 minutes past the hour, Texas Standard Time. I'm David Brown. Extreme heat sends many folks to the emergency room every year, and symptoms of heat stroke include fever, confusion, nausea, slurred speech, among other tells. Right now, this is an important subject because, of course, much of Texas is undergoing heat warnings, extended heat warnings. Well, there's some new data analysis from the Houston Chronicle, which finds that in the Houston region, thousands of heat-related hospitalizations occur annually, but the risk is not spread out evenly across the region. Here to tell us more, Rebecca Ward, who reports on climate and the environment for the Chronicle. Rebecca, welcome back.
Thanks so much. Nice to be here.
What did you find when you looked at where in Houston people are going to the hospital for heat-related illness?
So parts of downtown and northeast Houston have been seeing the highest rates of heat emergency visits so far this year. We have looked at data at the Houston Chronicle that the city of Houston has been compiling that look at heat-related emergency visits for the last few years. So we've been analyzing this year, which has had some particularly hot days, including what we've been experiencing right now.
Why downtown? Why do hospitalizations appear to be especially acute there?
That is a great question. There's so many factors that go into what makes certain areas more susceptible. So it's hard to isolate what exactly has caused the numbers to be higher downtown, but downtown has a number of the different features that might make heat-related illness hospital visits more likely. Of course, we do have a population of unhoused individuals downtown who are more exposed to the sun. We also have a feature of many of our heavily paved areas of Houston called the heat island effect, where specific areas with less greenery and more reflective surfaces actually do get up to, over 10 degrees hotter in some areas of Houston than in others. We actually analyzed by the zip code of residence of the patients because, of course, the immediate reaction from somebody living in Houston is that, well, the big med center is downtown. But the analysis is actually looking at where the patients are living and not which hospital they go to.
2,600. Compare that with previous years. How does it compare?
Well, the worst year in the past several years was actually 2024 for the Houston area, which makes a lot of sense because of Hurricane Beryl. So after Hurricane Beryl, we had very high heat days combined with a lack of electricity in much of the city. The data on heat illness is always an undercount. Because not every heat-related illness is recorded as a heat-related illness as people are being sent to the hospital. Since, if they have a heart attack or, another thing that might be triggered by the heat but isn't necessarily the traditional heat stroke, that might not be even recorded. So even with that caveat, in the couple of days after Beryl, there were hundreds of people who went to the hospital for heat-related illness.
Is there anything folks can do to stay safer or anything the city can do to improve the situation in neighborhoods at high risk?
Great question. So one of the most important things that doctors in the Houston area have told us is that new Houstonians and people who've been here for a long time should not underestimate Houston heat, because that can be one of the most dangerous things to do. There are a number of early signs that your body is not regulating well, from heavy sweating to feeling lightheaded or woozy, and learning those so that you can respond and cool yourself off quickly can help you avoid going into heat stroke, which is a life-threatening condition. And, several doctors in different ways told me that that's 100% preventable. People can bring themselves back from those first symptoms of heat illness to not go into heat stroke. The other thing is to not if you're not experiencing this extreme heat illness, but your body is starting to feel a bit weird after a couple of days in the sun, it's also important to recognize that other systems might be suffering, and not only, your kidneys can take the heat badly, your cardiac system. It's important to not think that just because I'm not having a heat stroke, the heat isn't affecting me. But the other thing that actually is something that the pro athletics teams in the Houston area are very careful about is to ramp up exposure to heat gradually. So, one doc that works with the Astros and the Texans mentioned to me that they have a ramp up schedule where they increase exposure 20% each day. And he said that ideally anybody who's exposed to the Houston heat, whether it's on a sports team or, high school practices, or whether it's somebody working outdoors, should definitely be ramping up gradually so that their body can get acclimated to the high temperatures, and not only the high temperatures, but the high humidity, which creates a heat index that has a more intense impact on the body than just the temperatures alone.
We've been speaking with Rebecca Ward, who covers climate and the environment for the Houston Chronicle. We're going to link to her excellent reporting on this issue over at texasstandard.org. Rebecca, thanks so much.
Thank you.
It's the Texas Standard. I'm Angela Kocherga. All across the Lone Star State, students are headed back into classrooms, maybe dreading their homework assignments, but also likely feeling a bit of school pride. So as football season kicks off, this is as good a time as any to ask ourselves, which high school in Texas has the most unusual mascot? This is a question David Courtney spent some time answering. He's a writer with Texas Monthly and the author of the advice column, Texanist. David, thanks so much for joining us on the Texas Standard.
Thank you, Angela. Happy to be here.
Well, Texas is a massive state with lots of high school mascots. Where do you even start with a question like this? For example, I went to Pace High School in the Rio Grande Valley, and our mascot was a Viking. And I don't think there were many Vikings arriving along the banks of the Rio Grande.
No.
So how do Texas high schools pick their mascots?
Well, I didn't really get into that. I take letters for the column, and this the letter writer was asking about if there was an organization in the state that kind of oversees the mascots. And I reached out to the UIL, which oversees high school competitions, and they do not do that. They led me to the a great website, the Texas High School Logo Project, which is a pretty good clearinghouse of high school logos, which includes mascot information and images of the mascot. So that was real helpful. Also, I had a book on my shelf that I'd actually forgotten about, but it was a book by a Texas author. It's about 20 years old, but it's called "It's a Jungle Out There: Mascot Tales." Mascot Tales from Texas High Schools, and it's by a man named Rob Sledge. So that was real helpful.
Are there any trends that you found as you did this research?
Well, no, like you said, the state's huge, and there's probably close to 2,000 high schools, and I just dealt with public schools. But it runs the gamut. There's everything. You name it, and we have it.
Well, what are some of the more memorable mascots you found as you looked into this? And what makes a good high school mascot, if you can answer that?
Well, that question, it's probably depends on where you're coming from or how you approach it. But really, a mascot serves a purpose, and it's intended to of course, serve the school it represents, by acting as a kind of totem is what I think I described it as, something around which the students and alumni and often even the surrounding community can rally around. So I guess the qualities there would include, being feared, being lovable, being intimidating, maybe somehow representative of the school they serve. Either of those, maybe all of those, all at once.
Well, tell us, what are some of the more memorable mascots? You probably saw some unusual ones.
There are lots of unusual ones. People are familiar with some of those, but in the column, which it's not a long column, but I probably list a couple dozen, and still didn't scratch the surface. But among
Give us
those,
some examples.
Okay, we have there's the animal kingdom is well represented. We have everything from San Sabahai's armadillos. There's numerous badgers, lots of bears and bearcats and golden bears, all those things you would guess, and of course the Brahmas, the Broncos, bulldogs. Lake Worth High is represented by the bullfrog, which is a little unusual. And I grew up in Temple. I was a wildcat, but small town of Academy nearby they're the bumblebees, which is, I don't know how many of those there are, but I don't think a lot. And then I think the eagles seem to be the most prevalent out there. But like you said, the letter writer, he was asking about unusual mascots. Also, was kind of the second part of his question. And there's a ton in that category. The nearby Hutto hippos are one that people are familiar with. New Braunfels, also nearby, they're the unicorns, which I think they're the only unicorns in the state. Mm. And then the famous Itasca Wampus cats. And I really like the Floydada up in the panhandle, the Floydada whirlwinds, which makes sense. And the winter's blizzards. Here in Austin, we have the Austin High is represented by the maroons, which is really a mystery. Nobody really knows what a maroon is, so that one's an unusual one.
So lots of animals. How about other types of figures? I mentioned Vikings for my high school.
Oh yeah, lots of Vikings, Cavaliers. There's all sorts of things like that. The Cameron High, also near Temple, where I grew up, is the Yeoman. That's a CHYO high school, but they spell it. Yeoman is misspelled to match the high school YOE. So the Yeoman there, and there's lots of those. But we have gladiators, cavaliers, exporters, oilers, plowboys.
Pretty much everything.
Yeah, there's a lot.
Well, all right. This might be the time for the big reveal. Which high school has the most unusual mascot in the Lone Star State, in your view?
Well, it was very tough, Angela. There's a lot of competition out there. We just barely scratched the surface here, but there's so many creative ones. And this one, I liked the Hereford, which is named for the Hereford breed of cattle, whose distinguishing characteristic is a white face. So the Hereford mascot is the white face, which is strange. But ultimately, I settled on the Rohawks of Randolph High. And a Rohawk, for those the uninformed here, is actually, it's a strange hybrid. It's part rocket and part hawk, the Rohawk. Mm. And in pictorial form, it's depicted as a angry hawk riding a rocket while gripping a lightning bolt in its talent. And I don't know what could be weirder than that.
I'm gonna have to go look at that one. That sounds fascinating.
Yeah, the Rohawk.
David Courtney is the author of the column The Texanist. You can read it in Texas Monthly, and you can find his column in a link at texasstandard.org, that story about the mascots. David, thank you so much.
Thank you, Angela. It's always a pleasure.
A Little League World Series dream has come to an end for a team from the Texas Hill Country. Bernie's All-Stars went into Monday's elimination game in Pennsylvania looking to keep their title hopes alive, and they had plenty of chances. But getting runners on base and then getting them to home plate turned out to be two very different things. Bernie stranded a dozen runners, 7 in scoring position, as Westside Little League from Hamilton, Ohio, racked up the runs. Bernie finally broke through with a run of its own in the bottom of the 6th, but by then a hoped-for comeback was out of reach. The final, 6-1. As the team from Bernie left the field, Texas fans were on their feet applauding a journey that began back in June and carried Bernie all the way to Williamsport for the second time in 3 years. There's more Texas Standard ahead, including an update on something many parents would rather not think about as kids return to school. Where do we stand with COVID? That and much more as the Texas Standard continues, coming up on 49 minutes past the hour.
Support for Texas Standard comes from Half Price Books, a Texas-bred new and used bookstore, proudly supporting public media and sustainability by keeping books, music, and other media in circulation. Store locations and more information at hpb.com. Support for Texas Standard comes from Texas Mutual Insurance Company, a Texas-based workers' compensation provider committed to providing care and support for injured employees. More at texasmutual.com/TexansDeliver.
This is the Texas Standard. I'm Angela Kocherga. Back to school means back to massive germ spreading now that students are back together in classrooms. In some cases, it's the common cold, but in others, it's COVID. For a check on the latest spread and what else might be going around, we turn to Dr. Catherine Troisi. She's an infectious disease epidemiologist and a professor at the UT Health Houston School of Public Health. Dr. Troisi, welcome back to the Texas Standard.
Thank you.
Well, it may seem strange to call it COVID-19 since we're now in the year 2026, but let's start with explaining that name.
Well, it was first detected in 2019. If you remember back that far, it actually didn't become a pandemic till 2020, but because we first detected it late in 2019, that's where the name came from.
Well, early on in the pandemic, the news was all about the different strains of COVID-19. Are we still tracking infections that way, or has it evolved since there are so many iterations at any one time?
You are exactly right. And yes, we are still tracking the variants, the changes that happen in this virus. Luckily, it has slowed down. And if you'll remember, I don't remember what year it was, Omicron, 23, 22. That was a big deal because it was a major change, and so we saw big increases in number of infections. Now, we have seen changes in that Omicron variant of COVID-19 since whatever year that was, but the changes have been small, and so people still have some immunity to the virus if you've been vaccinated or had COVID, which is about everybody. And so since last year, we've seen minor changes, no major changes, meaning that we'd see lack of immunity and people getting sick, which does not mean that you can't get sick from the current ones. It's just that you may have some immunity due to previous infection or vaccination.
Let's remind people again how prior infections or vaccinations help reduce serious illness.
So for most infectious diseases, you make antibodies, and that either fully protects you or partially protects you in the future. We can, I would say, trick the immune system to making those antibodies by giving vaccine. You don't get sick, but you make the antibodies so you're protected. So when your immune system sees that, in this case, we'll talk about the virus COVID-19, it says, I've seen that before. I'm going to attack it and get it out of the body. And so that's why you have some protection. Now, because COVID-19 mutates very quickly, as I said, luckily we've been seeing minor changes, but enough that your immune system doesn't totally recognize it. You can still get sick, but your immune system still does a good job of preventing more serious disease from COVID in most cases, unless your immune system is not up to snuff, like you're very young, you're older, you're immunocompromised, you have some underlying other medical conditions.
Well, so the CDC's website shows COVID infection rates are growing in Texas as well as the rest of the country. How significant is this uptick?
Well, right now, yes, Texas is leading the way. If we look at wastewater, where basically everybody contributes to the wastewater, so it's a good way of telling what's happening in the community. You don't have to wait for people to give blood samples or have their nose tested. We are seeing an increasing amount of COVID in the wastewater. However, levels of disease so far have not been high, but are increasing. And that's what we're worried about, that we're seeing an increase in the number of cases.
So is this expected, given it's the start of the school year?
So even though it seems like COVID's been around forever, it really hasn't been that long. And so we're still not positive what the seasonal distribution will look like. However, last year we did see an increase in cases in the fall, just like we're seeing this year. The role that school children play, again, is not totally clear. We know that for other viruses, respiratory viruses like flu and RSV, kids are real good at spreading infections because sometimes they don't wash their hands and they don't cover their cough and, they're together inside. So I think it would be a good guess that, yes, the start of the school season is contributing to this. But I also have to say some of these data are from before school started because there's a lag in reporting. So in a couple of weeks, we'll have a better understanding of whether there's an association with the start of school. When COVID first appeared, nobody had antibodies to it. And so that's why the seasonality is still settling in. We are not seeing influenza A or B cases other than a sprinkling, but the seasonal increase has not started yet. Sometimes it doesn't start till as late as January, but we do know with influenza that school kids do play a big role in spreading it.
Remind us of the telltale symptoms for those who don't remember. How do you distinguish it from a common cold, for example? I mean, losing your sense of smell is one we knew about.
Yeah, it's sometimes hard to distinguish it from a common cold, especially if you've been vaccinated or had it before, because, again, your immune system is most of the time making sure it's not as severe. So cough, sore throat, nasal congestion, fatigue. You may have fever or chills. Fever is less common with a cold, but can happen. You may be short of breath because of what's happening in your lungs. You could have a headache, nausea, and vomiting. You could have diarrhea. That sounds a lot like a cold, like flu, like some other things. So you really have to get tested to know whether it's COVID or not. And if you do a home test and it's negative, but you have those symptoms, it's a good idea to test 2 days later because sometimes that test won't be positive at first. So just to make sure it's not COVID, test again.
When will the next vaccine for COVID be available, and what do we know about who might be eligible to get it?
Very good question, because we don't know when the next vaccine is going to be available, because the Advisory Committee on Immunization Practices, ACIP, is not meeting. There is the manufacturers are making the vaccine. What we don't know is when it will be approved, and if it is not approved, will insurance companies cover it as they have in the past? Now, it's in their best interest to cover it because it's a whole lot cheaper to vaccinate someone than have them get ill, but we just don't know. And it's unfortunate that it is not available right now as we see cases rise.
Well, I have a feeling as we get into the fall, we'll be talking to you again. Dr. Catherine Troisi is an infectious disease epidemiologist and a professor at UT Health Houston School of Public Health. Dr. Troisi, thank you so much.
Thank you for having me.
We're out of time for today's program, but you can keep up with the news 24/7 at texasstandard.org and look for us on social media at Texas Standard. From all of us at the Standard, thank you for sharing part of your Tuesday with us. Hope you can join us again tomorrow. I'm Angela Kocherga, wishing you the very best from El Paso.
Philanthropic support for Texas Standard comes from Casey and Scott O'Hare, the Winkler Family Foundation, Lynn Dobson and Greg Wooldridge, Adrian Killam, and the George Huntington family.